In 2002, the Jamaican government signed to the Madrid International Plan of Action on Aging, where they agreed, among other things, to promote self-employment initiatives for older persons inter alia by encouraging the development of small and micro enterprises and by ensuring access to credit for older persons without discrimination, in particular gender discrimination, to promote equal access for older persons to employment and income generation opportunities, credit markets and assets, to ensure the access of older persons to primary health care and take steps to eliminate discrimination based on age or other forms of discrimination, to provide health care and social care professionals with continuing education programs with a view to an integrated approach to health, well-being and care of older persons, as well as the social and psychological aspects of aging, to promote equitable allocation of public housing for older persons, to ensure that the housing provided for older persons takes appropriate account of their care and cultural needs. Despite the existence of these international standards, there is gross denial of the social, economic and cultural rights of older persons in Jamaica. Older persons are oftentimes victims of discrimination in trying to access healthcare services, transportation, government services, microcredit and insurance services, among other forms of discrimination. In 2007, Help Age International launched its Age Demands Action campaign. This is the first worldwide campaign of its kind and is implemented through the Help Age Global Network. Specifically, Age Demands Action, ADA for short, is a campaign aimed at combating the perception that older people are not important and should not be included in society as equal citizens. ADA fights age discrimination wherever it exists. Help Age International, working along with partner organizations and older persons themselves, has decided to host the ADA campaign in Jamaica for the second consecutive year. Adequate housing is a sore point for many of Jamaica's seniors, a large number of whom are either homeless or live in poor housing. Several are homeless for a variety of reasons, including natural disasters, fires, violence, family abandonment, among other factors. Ms. Hermin Leng tells us more about the housing crisis faced by Jamaica's seniors.
Many of us have lost our houses to storm, earthquake, fire. And because of that, we are forced to live in conditions that are not suitable for human living. We live in old trucks, old cars, along the street side. We were once owners of homes. We used to pay even housing trust money. We are left to many dangers. Many of us older persons house grandchildren, and because of that, or the condition in which we live, the children cannot function properly.
15th of June 2010, while they were asleep, her grandson heard a cracking sound, and when they awake, they found out that the roof was falling down, so they ran out and alerted her, and they all try and got out safely.
Me have two little children, and them got to run out. When them got to run out, you know. And then said, then when there's something I come and they have to run out. And see, as them run out now, a piece of board just drop right, we see right to spot them lay down, right, that's how the board drop. And if then nobody get up and run out, they wouldn't head out of bus up, you know. It rain fly like it's falling out here, inside. We
look to the government to look into our plight, put house project so that we too can live a respectable life, put house repairs project in place that those of us who have houses which need to be repaired can be affected. And we are saying that we are not looking for far future, but near future for our needs for housing to be met.
I want one little place to myself, you know, Mr. Thompson.
In addition to the challenges faced with housing, older persons also encounter problems with health care. In accessing healthcare, older persons come up against high transportation costs, long waiting times to see doctors and at pharmacies, high cost of medication not covered under the National Health Fund and the Jamaica Drugs for the Elderly program, the shortage of medication and poor customer service at pharmacies and public healthcare facilities.
I am Samuel Bailey. I am speaking about healthcare for older persons. Whenever they went to the hospital for treatment, they are sometimes shunned and given the runaround before seeing the doctor, waiting a long time. If they went from in the morning, it's always night before they get a chance to see the doctor. Whenever they see the doctor and prescription is prescribed for them, by the time they reach the pharmacy is closed. Now they have to go home and bus fare the next day again to come to hospital to get the medication. When they come for the medication, they have to get up early in the morning to get number, and a lot of people is doing the same thing, getting up early. And the older person, some of them can hardly walk, is in a disadvantaged position, have not getting early ticket that they can get their medication. Sometimes they have to wait until evening before, and sometimes when they go to the pharmacies and ask about their medication. Have you got this? Sit down and wait until your number called before I can tell you. And when your number called you that them don't have it, that means you have to go to pharmacies and buy it. And sometimes you don't have the money to buy all those medication. Sometimes the nurses give them a hard time, say they are miserable. Don't have time for you, old lady, because you're not too miserable and get too much worries. They are getting a lot of attitudes from the peoples that's supposed to be taking care of them. And now I'm not too happy about the health care for the older person. Because, because of the age, I don't know why. But I feel it's because of the age, why they treat them that way. They're more quick to look about the younger person than the older person. My experience, I went to the hospital at the Kingston Public Hospital, and I was there a long time, from in the morning. And a lot of older person was on the bench sitting down, waiting to see the doctor. And the porter or the security or who give out the ticket and position you for to see the doctor. A young lady walks in, very attractive. I'm not saying much about her attraction, but she was young and she was attractive, and right away the security guard give her much attention, calling her to him, and she came up to him and he asked her quietly, such and such. I didn't get to hear the conversation, but at the same time he gave her a number and she was able to see the doctor, and she just walked in. So I don't know why. I don't know why that partiality is. And what I'm saying is, I'm not really divulging upon because she's young and attractive. But I have to use that experience in seeing that is the cause, because the older person was there from early morning, and she just come in and get through with the doctor. So I don't know what kind of system is that. That shouldn't be so. I would like to see the government administrate one doctor. Like when you're going to the bank, you have this line for the senior citizen. I would like to see the clinic and the hospital administration have a line, especially a line for the older persons. You have a line to see the doctor, the older person line, this is the line. You have a line to the pharmacy, you have a door that older person can pick up their medication without the interacting with younger persons and then pushing them and treating them bad. That is one suggestion. And again, I would like to see the drug serve, what them have, the drug serve. I would like to see they have a mobile drug serve for the older person. And I would like to see the attitude of the nurses and the caregiver at the hospital towards older person. I would like to see their attitude change.